Hi, I'm Dr. Mark Laney, the CEO of Mosaic Life Care, and I'm here with my fellow physician leaders, Dr. Turner and Dr. Kammerer, to give you an update about all things COVID, COVID relative to Mosaic Life Care. We want to give this update to everyone to let you know that we are experiencing record high COVID numbers, record high COVID inpatients, and unfortunately staff shortages. We must not let our guard down. We know that everyone is weary of COVID after 2 years of it disrupting our lives, but we are in a circumstance today where we have more COVID patients and more challenges than even a year ago. So this is a very serious circumstance. We want to reassure you of our preparations and what we're doing to take care of everyone, but we also want to ask your help in doing what you can to decrease our hospitalizations. We are blessed to have two other hospitals in our health system, Maryville and Albany, and they work closely with all of us on a daily basis in moving patients and moving resources back and forth to meet the needs of Northwest Missouri. We not only move patients, but we move staff, and we share critical supplies, and that has been a blessing. We stand in awe of all of our caregivers who, as you can imagine, are quite tired and stressed after fighting the battle for so long. And yet, each and every day, they come to work and courageously serve our patients to give them the best and safest care. So as of today, we have 73 COVID patients in our system. 68 are in St. Joseph, 2 are in Albany, and 3 in Maryville. And that's actually down from several days ago where we were in the 80s. Our 7-day positivity rate is 38.83%. It was about 28 several weeks ago. So you can see that the positivity rate, which is an indication of the spread of the virus, has significantly jumped in recent weeks. And when those rates jump, our hospitalization rate jumps. And last week we hit a weekly record of the number of tests that we performed, which was 1,200. So, what are we doing to help the community besides taking care of our hospitalized patients? We have created a COVID-19 hotline that people can call to find the best place for them to get a COVID test if they need a COVID test. And that number is 855-577-0211 to help you find that COVID site that's closest to you. 855-577-0211. And those testing options include St. Joseph, Maryville, and Albany. The hotline is answered 24/7. Other information that we want you to know, we want all established Mosaic patients, if they have a need, to first call their primary care office for directions. Non-Mosaic healthcare patients will be directed to locations that are set up by Buchanan County Health Department as well as urgent care. Callers will be informed to please not use the emergency room in any of the hospitals as a primary testing site. That creates a logistic nightmare for patients that are critically ill. And there are other testing sites at such places as Hy-Vee, Walgreens, and CVS. Now, anyone can also speak to a nurse anytime by calling our 24/7 nurse hotline. You don't have to be a Mosaic established patient. 816-271-4000. And finally, again, I can't emphasize this enough, please do not use our emergency rooms as a primary COVID testing option. So the other thing that we have done is we've reopened our Mosaic Respiratory Clinic, and this is for established Mosaic patients, and they need a referral from their primary care doctor, and they can get screening. It's on the north side of our campus, and we hope that this will decrease the number of patients needing to be tested and going to our primary care clinics. So with that information, I'm going to turn it over to Dr. Kammerer, who's going to talk about a little bit more granular detail in regards to supplies and staffing and where to go for care.
Thank you. Thank you, Dr. Laney. I'm Dr. Kammerer. I'm the Chief Medical Officer and Chief Quality Officer for Mosaic Health Systems. Today I'd like to kind of discuss where we're at with regards to supplies. Early in the pandemic, one of the issues was a lot of issues with regards to supply chain, with regards to protective equipment for our personnel. Mosaic has taken a very aggressive stance with regards to acquisition of supplies and has really done a good job. We have stockpiled those in anticipation of this surge based upon the holidays. So from a personal protective standpoint for our employees, we have ample supplies, and we've done a very good job of acquiring appropriate medications. So we have no issues with regards to supply, with regards to taking care of patients. One of the things that is difficult is when you run into supply chain issues is acquisition at this point in time, because the supply chain is stretched, as you've seen across the news. So again, fortunately, we're in great shape there. We have acquired some additional ventilators on request from Region H Healthcare Coalition. We don't anticipate the need for those ventilators. We have ample ventilators at this point in time. But if the surge to continue, or if we were to need to accept transfers from other portions of the state, we could potentially need those ventilators. So we've got the process going where we'll acquire additional ventilators. As far as the biggest issue when it comes to this current surge, it's really about staffing. This has been the problem. We've been at this now we're in our third year of COVID. We've completed 3/4 of a year, we've had a full year, and we've just started into our third year of COVID in effect. So with that being said, the staff is tired. We've been working hard for a long time. We do have an extensive plan in place. We're here to take care of your needs. We are not curtailing any of our other activities because we want to make sure that we don't harm any patients by not doing the appropriate care at the right time at the right place. So what we do have in place is we have a tiered system approach that we will meet our staffing needs. We're actively looking for agency. We are drawing from our resource pool that we have inside of our community of people who have already retired and volunteers to help stretch our staff. And in addition, what we've done is we're actively engaging new nursing and getting new hires oriented and up to speed as fast as possible. We have a very significant tiered plan as to how we will approach it, including possibly going to more virtual office visits in the clinic and additional utilization of clinic staff if the numbers get to that point. At this point in time, I want to reassure the public, though, that we're here to take care of you. We have the appropriate resources and the appropriate staff. However, we can use your assistance. The navigation of care is one of the biggest issues that we face. Things can get bottlenecked very quickly. So as Dr. Laney alluded to, what we really want to avoid is jamming up the emergency room. We have alternate testing sites available, and we're going to ask that you strongly consider contacting your PCP. And if you don't have a PCP, this is a great time to go ahead and establish with one to get yourself an access point into the healthcare system. We ask that you contact your PCP before you access the urgent care or the emergency room for COVID-related illness, if at all possible. If you are very sick and you think you need the emergency room, it is there and available for you. But your assistance with minor issues with regards to COVID, with regards to testing and treatment, if they can be handled through primary care, that's going to free us up with regards to being able to take care of normal business as well as those who are gravely ill in the emergency room who have COVID. So from a navigational standpoint, this is a big deal. In addition, we're also concerned a little bit about the flu. You know, we're starting, last year we had virtually no influenza. I think from January through May, we ended up with about 13 cases of influenza total inside of our system. This year, 2 weeks ago, we had 128. This last week, we had about 78 positive flu tests. The news is talking about flu-rona, which is flu plus coronavirus at the same time. If you get if you stack two diseases, that can be a difficult situation. So obviously in our situation, what Mosaic is strongly recommending is consider vaccination against both of these diseases. Both the flu this year, because we're certainly seeing increased numbers compared to last year, as well as it's not too late to vaccinate against coronavirus. And we do strongly recommend that you consider full vaccination and the booster if you've not had it. In addition, the other aspect the community can help us with is to continue those practices that we perfected over the course of about a year and a half. And those were to wash your hands, socially distance, and wear your mask when you're in large company. So if you're around a large number of people, it's okay to wear your mask. At Mosaic, we strongly support those endeavors inside of our community. So with that,
We're open for questions,
When
gentlemen.
you talk about staff shortage, where are we? What's some specifics? How short?
so from a staff shortage standpoint, we're managing it well right now. We haven't had to alter our schedule or alter any of our activities at this point in time. However, if the numbers continue to go up, as you see nationally, last week, or on Monday, I guess we had 1.4 million positive cases. That is almost 3 times the peak cases that occurred on a daily basis across from the previous surges. So if that surge were to continue to go up and we got stretched, then we would have to implement some of our staffing plans. At this point in time, it's business as usual and operation as usual. However, we do recognize that there is the potential for some staffing stretch.
And is it because staff have COVID, or what?
There's really two factors. One is open positions. There's a national shortage of nurses, and the complicating factor of traveling nurses and the expense and uncertainty of that. But the second part is we have about 100 caregivers out with COVID right now. And so that's just an additional stress on the system. This is one of the reasons that we have mandated vaccinations for our caregivers, because we can't afford to have a huge percentage of caregivers out with COVID, because then it just really restricts our ability to take care of everyone else. So we're okay for now, but it's tight.
Given what you just said about taking that level of personal responsibility, with everyone wearing masks and doing things to prevent the spread of this, do you think it's time to go back to maybe mask mandates or at a city level, things like that? Have you considered that to try and keep things down, or pushing that on?
We try at Mosaic not to get on in the political side of things, and I know that so much regarding COVID has become politicized. I don't think, just on my personal experience, that St. Joseph has the will, or would it be well received to go back to mask mandates. From a practical standpoint, I don't think that's going to happen. But we all have personal choice and accountability. I was in the grocery store yesterday, and I proudly wore my Mosaic mask when I went in to buy some chips for the football game last night. So, these make a difference. We think one of the reasons we had such a almost nothing regarding flu last year is because people wearing masks was a lot more prominent. And every little bit helps. So we would encourage people, especially when they're out and about or in a large group, to wear a mask. It's an easy and safe, and we think reasonable thing to do.
There's been some news about hospitals in Kansas City being difficult to accept transfers. I guess, how does staffing or capacity, even at other area hospitals such as KU Med or hospitals that you usually send people to, how does that impact potentially day-to-day operations here at Mosaic?
Absolutely. So we are very cognizant and aware of the situations in other institutions in our region. It's critical because the healthcare system in America flows together. And what happens downstream, if KU or if St. Luke's is backlogged, then that backs up everybody who flows into them. So we're acutely aware of their situations, and we pay attention to that because it does influence how we adjust for our business. It also means that we have to be more accepting. We'll be called upon more if they're indeed full, and that is a problem in Kansas City and nationally. This is the ebb and flow of healthcare. So what we're seeing is a lot of institutions who are definitely at capacity. So again, it does affect us on a daily basis with regards to our staffing decisions and what we do.
Is the idea of triaging patients, is that too dramatic of an idea? Is that something that could it be something that happens?
So triage is something that we undertake at all times. We're always triaging. This is one form of triage. We're in what we just discussed, which is we really advocate that if you have COVID-like symptoms and they're not terrible, that we advocate that you contact your primary care. That's one form of triage, to try to push care to the right place at the right time so that we can deliver the other care, the more significant or severe care, in the right setting as well. So we're perpetually in a mode of triage. It's the degree of triage that occurs.
You talked about transfer. Is there an anticipation that Mosaic will be asked to take COVID patients from other parts of the state or the region?
We are continuously taking patients from other regions. We accept patients from anywhere in northwest Missouri. We certainly accept them from Albany and Maryville, but all the regional hospitals at some point in time throughout the last 3 surges have actually transferred patients to us. So again, we are part of a collaborative system. We want to help our fellow hospitals and the region to the best of our ability, so long as we have the capacity.
I've heard of northwest Missouri being a hot spot, or I guess we could include northeast Kansas. How serious is it in this area?
So this is great. That's a great question. I think that when you look at the situation, Omicron has offered some interesting aspects. It is clearly more infectious, but less virulent, meaning it transfers easier, but it also appears to not create quite as many hospitalizations. So this is, but the problem is, if you look at the surge, we had 1,100 positives last week, or 1,200 positives last week. So even if a smaller percentage of those folks end up in the hospital, if the total number of infected at any given moment is higher, it still creates the potential for a significant surge, and that's what we're seeing across the country right now. Again, we're not seeing the hospitalization rate, but when you have 1.4 million positives in a day versus what you were having a peak of about 300,000 or 400,000 before, again, it doesn't take long. Even if the lower percentage ends up in the hospital, there's still a lot of people. And that's where we're seeing a lot of the nation is in crux with regards to capacity and what they can handle.
Have you guys had to turn any patients away? And is that something that, at a certain point, I guess, what point does the capacity have to reach to where that could be a reality?
So we're well aware of that number. We don't want to really get into exactly what that number looks like, because there's a lot of mitigation strategies that can occur in the meantime. A lot of hospitals will start to decrease elective procedures. There's personnel we can draw from our clinics and make our clinics try to make those appointments more of a virtual. So there's a lot of modalities that we can extend our capacity. As it stands today right now, it's operations as normal, but Dr. Turner has done a great job of setting us up with a very significant tiered system that allows us to continually evaluate that, and we know what our number is and how we need to adapt to that number as things go along.
Things are very tight. And the system on a daily basis and our caregivers are undergoing a stress test. Are we in a crisis mode? No. Could we be in a crisis mode? Yes. And we saw that happen in Kansas City over the weekend, where one of the major health systems went on divert. And, normally we act in a tremendous collaborative manner, share patients, transfer patients, help each other, and we always still want to try and do that. We try each and every day to be what we call a yes hospital. When somebody needs our help and they need us to come get a patient, we want to be able to say yes. But just like in every situation in life, there are some limits and constrictions. And what we're asking is the public to help us, to do your very best, to try and minimize the number of folks that are getting COVID to the point where they have to come to the hospital. And that will make a difference.
I was real interested, I think, Dr. Laney or Dr. Kimmer, I didn't know which one compared it to a year ago, but you said this was as bad as a year ago or close to it, or how, or just open-ended, how does it compare?
Well, when you look at the number of infections, it's far surpasses last year. So again, Omicron is clearly more infectious. Virulence is how sick do you get and how often do you end up in the hospital. It appears to be less virulent than the Delta or the original wild strain, we call it. So the reality is when you look at the number of hospitalizations, we peaked at right around 100 in the last year. We're currently running in the low 70s, mid 70s. That's where we are. So from a hospitalization standpoint, we're not as bad as we were last year. When you look at the number of infections inside of our community, it's substantially higher, which leads us to the potential for more problems.
Have you seen a difference in, I guess, symptoms of people that are hospitalized with the Omicron variant, but also has there been any changes to the strategy needed for treatment and in the COVID care of patients?
And this, to the point, to the question earlier, this is one of the facts that we're much better off with regards to what we have available now. So I like to look at this in a systematic way. We have the preventative therapies, which are vaccination, and and wearing your mask, washing your hands, and socially distancing. These are preventative strategies. So we have those, and that's critical. The next is what I would call the mild disease. So we have a couple of new oral medications that are going to be available soon. We have a few doses now, again, for treating more of a mild disease. Then we have the antibody infusions that you hear about, the Regenerons and the BAMs and the Satruvimabs and the type of things that we have now that we can infuse you with, which are antibodies against COVID. That's prior to hospitalization. And then when you get into hospital, we have several weapons at our hands now that we didn't have before. So from a spectrum of where we were last year, we have many more weapons available, which is great. However, that also does require more staff to administer because these are more interventions that we can do, but all those have to be utilized in the right setting at the right time at the right place. And so again, it does create, there's pluses and minuses compared to last year.
We haven't talked a lot about vaccinations, but has the vaccination and the booster proven effective against Omicron?
This is a critical aspect. Again, we would encourage you to reconsider the vaccination question. Look at the numbers. Do the math again, because here's what the numbers we're seeing. 80% of the people in the hospital are unvaccinated. 20% have been vaccinated. Do we see breakthrough cases? Absolutely. But their length of stay in the hospital is lower. They're very, very rarely have they ended up on a ventilator. And consequently, there's absolute proof that the vaccination does reduce the severity of illness, the length of illness, and again, it's time to reconsider that idea.
And the mortality.
And the mortality, absolutely, good point. I mean, that's the most significant aspect is, realistically, of the deaths inside of our institution that we've had over the course of the entire pandemic, we're running roughly 4% of all the deaths have been in people who are vaccinated. 96% of all the deaths are unvaccinated. Do the math again.